All right. Now, let me first start off by asking you guys where you are in your Medicare process. Are you new to Medicare?
Yes, we haven't done anything yet.
And who gets to sign up first? Who's eligible first?
Me,
Very good. And when are you eligible?
I already am. Because
Okay,
my 65th birthday is May 14th.
very good. And have you uh, uh, contacted the Department of Social Services to get your Part A and or Part B in place?
No, I have not done anything yet. This
Okay,
this is
that'll
the foundation work.
gotcha. So that's going to be step one. I'll tell you, my experience has been, I've got a 90-year-old mom who's blind with dementia, and after my dad died, I had to kind of close down his accounts and consolidate them, all that stuff. And I had to go in and chat with the Social Security folks a couple times. You can either call them, you can do it online, or you can go into an office. But remember that getting Part A and Part B in place is your first step, because then we can't do anything with either Medicare Advantage or Medicare Supplement, the kind of the plans that go along with original Medicare. We can't do anything with those until you get your Medicare number. Okay.
Okay.
With that said, I do have a very comprehensive presentation that I will take you guys through. Let me share a screen here. Share.
Well, that's
I have a question before you get
Go,
started.
go ahead.
Okay, so Dan and I are, well, Dan is currently on his employment healthcare program, which I think right now is Aetna.
Hmm.
And so he's gonna pass over the 65 mark. We're still, he's still working and we're utilizing the Aetna. If he signs up for Medicare A or B or whatever, but doesn't use it, are we going to get billed for the Medicare if we're not using it, but we've applied for it?
The Part A is that's a very good question, and uh, Part A premiums are usually covered for you. Part B, if that's the case, you would want to wait to sign up for your Part B until a little bit closer to your separation date. Because as long as you're still working and you're on an employer-based plan, you have what we call creditable coverage. Okay. So none of the deadlines and the penalty marker deadlines, none of those apply until you stop the creditable coverage from the employer. Does that make sense?
right.
Yeah.
In other words, I have to sign up to set the foundation, but I don't have to pull the trigger until I'm ready to retire.
Correct.
Okay.
That's what, thank you. That's exactly what I wanted to know.
And I'll also tell you that, the folks that I've worked with in Social Security, helping people with Medicare and other things, they're actually great. You might have to wait on hold for a little while. It is a government agency. And as with most of our government agencies, we don't really know what's going on with them right now, whether there's
Yeah.
anybody even still left working there. But suffice to say, of course, there are people still working in Department of Social Security. But just, set aside some time, get on the phone with them. They will be able to tell you specific to your actual case, hooked up with your Social Security number, what kind of hurdles you got to jump over and what do you got to do to get the Part A and Part B. It should be really, really easy. Okay.
Mhm.
But they're the gatekeepers for that. Folks like me, we're the gatekeepers that help you out with the private insurance plans from other companies like Aetna, like United Healthcare, like Anthem,
Mhm.
after you get your original Medicare, your government benefit. Okay.
Perfect.
But I'm going to tell you all about everything. I've been doing Medicare since 2006, know it very, very well. But as you know, as I've just explained, there's a couple things that I can't do, and you really do have to talk to Social Security to get the dead on of how it applies to your specific case from them. But usually it's just a phone call, they'll get you signed up, you're going to be fine. I am an independent broker. I work for my clients, not the insurance companies. Some people are misinformed about that. So there's no charge for my service. I get paid if I sign you up on a plan. And it used to be before the pandemic, I'd go around to senior centers and senior housing communities and deliver this presentation uh, to groups. But now, after the pandemic, I do everything over Zoom. And quite frankly, I never leave the house.
Nice.
I work from home also.
You know, I have to say, the silver lining for me, because I do other things as well. I do a lot of retirement planning as well. Medicare kind of falls into retirement planning under that umbrella. And it used to be that I'd go around and I worked a lot with um, public school employees. I'd go around to school districts, give presentations on 403Bs and retirement planning, their state pensions, et cetera. Um, to the CTA meetings, do luncheons, do dinners, all that fun stuff. And I spent 125, 150 nights a year in hotels. And of
Cool.
course, that all came crashing down in March of, what was it, 2022 now? Um, I can't even remember what year it was.
2020.
So kind of had to readjust my way of doing things here.
Mhm.
And like I said, now even with all the retirement planning stuff, I do that all via Zoom, and I never leave the house. The first 6 years of my marriage, from 7 years from 20, the first 10 years of my marriage, really, I was in hotels 100, 125 nights a year. My wife had never been around me nonstop for like that. I had to check to make sure that she wasn't going crazy and planning to kill me. But fortunately, when I asked her, she's like, kill you? You make dinner every night. Why would I kill you?
Love it.
Um, so your initial coverage enrollment period, it's twofold. It is either the 3 months before and the month you turn 65 and the 3 months after you turn 65, or you have 3 months after you lose your creditable coverage, after you separate from your employer, you get 3 months to sign up for your Medicare with no penalty.
Okay.
And then the annual enrollment period. This is when you can make changes to your existing plans. This is most commonly taken advantage of by folks on the Medicare Advantage plans, which I go into very thoroughly later in the presentation. Annual enrollment period, when you want to make changes to your plans, that begins October 15th and ends December 7th every single year. That's why you see beginning around September and the beginning of October, hours and hours of commercials about Medicare plans if you watch TV.
Oh,
It's,
they come through the mail too.
and they come through the mail. I will tell you how to, if you ever get telemarketers calling and things like that, I will tell you how to get rid of them and make it so if they ever call you and bother you again, you will get paid.
I like that.
Oh, okay, that works.
More enrollment periods. The Medicare Advantage open enrollment period. This is kind of a new one. They started it a few years back. For folks on Medicare Advantage plans, if they enrolled in a plan during the annual enrollment period that they decide that they don't like, or if they are on a plan and didn't make any changes during the annual enrollment period, they have another enrollment period that goes from March 1st January 1st through March 31st every year. So Medicare Advantage folks may switch to a new Advantage plan, or they can go back to original Medicare and get a prescription drug plan and or add a supplement or Medigap plan, which I will explain in more detail. Special enrollment periods, these occur when one has a qualifying change in circumstance. The most common is if you move out of the service area of your current plan, you have a special enrollment period to find a new plan in your new area. Less frequently, plans will reduce benefits or coverage. And if that is the case, then you probably qualify for a special enrollment period to find a new plan. Also, if your finances change and you become Medicaid or Medi-Cal eligible, then you get a special enrollment period as well. And the reason that you do want to get on Part A and Part B during your eligibility times is because there are penalties that'll follow you around for the entire time that you're the Part A enrollment penalty. It's a 10% premium penalty, so you're going to pay 10% more on your Part A premiums. And you'll pay that for twice the number of years that you waited to sign up after you were eligible. But you guys aren't going to let that happen, so we're not going to worry about that.
Yep.
Part B enrollment penalty, same kind of thing, goes up 10% for every 12-month period a person is eligible to enroll but does not. So we want to avoid those penalties. And even the prescription drug plan penalty, this one's probably the worst of them. It's the one that I see people suffering from most frequently. And if you wait longer than 63 days to enroll in a prescription drug plan after losing that creditable coverage or being in your initial enrollment period, you get a 1% penalty of the national average of the prescription drug plan premium per month that you didn't enroll. So if I've met people that waited 2 years to get on a prescription drug plan, mainly because they didn't even know there was a penalty and they weren't taking any prescriptions. So they're like, why do I need a prescription drug plan? Well, in that case, I always tell folks, great that you're not taking any drugs, still get on a PDP plan. Find the cheapest one in your area that you can get so you're not paying for it and avoid that penalty, because some people are paying 24% more for their prescription drug plan than they should be paying, really. And that follows them for life. The prescription drug plan enrollment penalty never goes away. The different parts of Medicare, A, B, C, and D, and what they do. Part A covers all your inpatient hospital services, skilled nursing facility, and hospice. Part B covers all medically necessary services, your doctor's appointments, preventive services, durable medical goods, devices, etc. Part C is what we call Medicare Choice or Medicare Advantage plans. They didn't exist before 2006. Neither did prescription drug plans, the Part D. Those were all part of what we call the Bush Medicare overhaul in 2006. Previous to that, we had different ways of doing things. The Medicare deductibles 2025, your Part A deductible is $1,676. This goes up every year. The good news is that 99% of Advantage and supplement plans cover your Part A deductible.
Oh, that's good. Yeah.
Your Medicare Part B deductible is $257 per year, and it resets every year. It goes up a little bit every year. None of this stuff goes down from year to year, is what I've seen. And so when you go,
Mike,
go ahead.
sorry to interrupt.
That's okay.
ask a favor to go back?
Please do. I'll
Right.
always jump in with questions. I'm a verbal steamroller when I'm doing my presentation, so just go ahead and interrupt.
I like that. Can I just see the last slide just for a quick second?
Sure.
Part A. So part A.
Oh, I should introduce you guys to this notion. Remember that original Medicare, the benefit that you get from the government, Part A and Part B, you can have only Part A and Part B. You're allowed to do that. They're going to cover all these things up here. They're going to cover those services at 80%, leaving Medicare beneficiaries, that's you, to cover 20%. So, think about if you break your leg, end up in the hospital in traction, and need to have a pin put in your leg or something like that. That's like a $150,000 operation. That's what the hospital's going to build for it. Medicare would pay 80% of that. You're going to be on the hook for 30,000 bucks. That's why we have these Advantage and Supplement plans, though
that's what Part C and D is, right?
Part C is the Medicare Advantage plans. Part D is prescription drug coverage. Correct.
Right.
Medicare Supplement is a kind of a different thing. It has been around for decades. The Medicare Supplements have for a long time, and I'm going to give you a thorough discussion of the differences between Advantage and Supplement plans. Okay.
Yep. Got it. Thank you.
So the deductibles, remember that, so your Part B deductible, your preventive services are always covered, okay? So if you got to go for a colonoscopy, when you go in for your annual wellness exam, if you need to have a mammogram, those are always covered at 100%. That is one of the improvements that we've made to our healthcare system in the past decade. But if you go for, say, a specialist visit, or you go in for an X-ray because you think you broke your leg and you want to find out, that's when your deductible is going to hit. And, like if you go in for an X-ray, it's going to cost you $257 at the beginning of the year. After you satisfy that deductible, then it's covered according to however the plan is going to cover it. And the Part D deductible is all the way up to $590 this year. And that is for your covered prescriptions. You're going to pay the first $590 of your costs annually out of your own pocket. And then the prescription drug plan is going to kick in and cover stuff the way it will.
Okay.
I'll explain that to you later on as well.
So Mike, for that point on Part D, that's not company specific on the type, like say it's ABC company for Part D. It's not unique to that company. It's just the way the rules are.
Correct. It's not unique to the company. That's actually government set things. Important to note that, before 2022, they had Medicare supplement plans that would cover your Part B deductible, but I believe it was as of 2022, they got rid of Plan F, I think it was. People that are currently on Plan F get to keep it, but you can't enroll new folks on Plan F. So everybody enrolling in Medicare now gets to pay their Part B deductible.
Okay, thank you.
Your Part A premiums, this gets a little bit confusing here, but generally most people don't pay Part A premiums because they've worked at least 40 quarters and paid in through their Medicare taxes. If you've worked for 40 quarters and paid 40 quarters of Medicare taxes, then you will not have a premium for Part A. If you've worked less than 30 quarters, you're going to pay $471 a month. If you worked from 30 to 39 quarters, it'll be $259 a month. Quite frankly, I did not look up yesterday these two numbers here. They might be more right now, but you guys have worked 40 quarters. You're not going to have to worry about it, right?
So when you say 40 quarters, you're talking about basically 10 years, right?
Right.
Okay, yeah, no, that's not a problem for us.
Yep,
Good,
we're
good.
senior people. Worker.
Here's something that may apply to you guys. Um, and that's the Part B premiums. And the way it works, generally, your Part B premiums are just going to be taken out of your Social Security check. That's part of what you uh, uh, get taken care of with Social Security when you sign up. So there are going to be Medicare Part B premiums, but it comes right out of your Social Security check. So it's kind of painless because you don't even really know that you're paying it in a way. You guys are married and file a joint tax return, correct?
Yes, correct.
So if you make $212,000 or less, um, while you're on Medicare, you'll pay $185 a month for your premiums. And this I did update yesterday, so it's up to date. Um,
And do we get a copy of this slide deck?
I can email it to you, yeah, but it's kind of a big file. Sometimes it doesn't go through, but I can
I
certainly
understand. That's
email it to you
we're
guys.
going to take notes too, but I was just curious.
Right.
And so for us, since we fit in the second category or the second line at 259, so that's $259 a month a piece, or $250 a month for both of us.
259 each. But here's one thing that you have to think about. Right now, you're working and you're making a lot of money. Um, After you're not working, you might be making less money, correct? Because you'll be
Right.
taking
That's
income
true.
from your retirement accounts.
Yeah.
And so you'll probably end up being here on the first line, unless you've done a bang up job of saving for retirement and you have like several $1 million stashed away. Then yes, you
Not
might be
quite.
paying.
Okay.
Um,
Still building.
Remember that there's Medicare premium assistance available for people with low incomes. Probably doesn't apply to you guys, but if you know people that are quite low income, it's something to keep in mind. They should talk to the Department of Social Security, see if they qualify for premium assistance. Here's the fun stuff where we start talking about the difference between Medicare Advantage and original Medicare and a supplement, okay? So I start with Medicare Advantage because it's actually the more complex plan to understand and the way it works. So Medicare Advantage plan or a Medicare Advantage prescription drug plan, um, it turns your Medicare into an HMO or PPO. We're familiar with these because we have employer benefits, and all employer benefit plans are either an HMO or a PPO. You guys know the difference between HMO and PPO?
Yeah.
Oh,
Yeah.
yeah.
So if that's the case, if we sign up with Aetna's Medicare Advantage plan, then Aetna becomes the administrator of your Medicare benefits. If you stay on, it's important to note with a Medicare supplement, you continue to be on original Medicare, so the government continues to be the administrator of your benefits. The supplement simply kind of steps in and plugs up and covers all of the 20% that original Medicare doesn't cover, all or a portion, depending on what plan, okay?
Mhm.
Back to Medicare Advantage. Generally, you got to see network doctors or you're going to pay more out of pocket. That's the way HMOs or PPOs work.
Right.
The Medicare Advantage combines Medicare Parts A, B, and C. Remember, Part C is Medicare Advantage,
Mhm.
and often D. So the MAPD plans are kind of one-stop shopping. They contain everything. It is important to note that they are not standardized. Plans vary greatly in how they cover benefits, but must be at least as good as original Medicare. Your Aetna Medicare Advantage plan might cover x-rays differently in your zip code than it does even in the zip code right next door to you guys. What zip code do you guys live in?
95112.
San Jose area.
I was there.
Yeah.
It becomes important with the Medicare Advantage plans. Medicare supplement plans are standardized. Medicare supplement plan is going to cover your x-ray and everything else the same in your zip code and county as it does in the zip code and county next door, as it does in Florida, as it does in New York, as it does in Washington. They're standardized at a national level, okay? With a Medicare supplement, you have to enroll in a standalone prescription drug plan. They don't combine. Medicare supplement plans continued. Remember, it's going to cover the 20% that Medicare doesn't cover. They have a 30-day free look period. So after you sign up for it, you get to try it out for 30 days and look at it. If you don't like it, you can say, I don't like it, and you can find another plan. They are guaranteed renewable as long as you pay your premiums. So no matter what happens to you health-wise. Oh, I didn't even put my camera up. You guys are able to see and hear me okay, huh?
Oh, yeah, we can see you.
That's so weird. I've been using a separate camera for the past 2 months because the camera and microphone built into the computer shut down, but apparently they're working again now. Medicare supplement plans automatically update with cost share increases and or decreases. There's never really any cost share decreases. There's enrollment discounts available to qualifying applicants. It usually, in California, your enrollment discounts come into play if you both sign up on a Medicare supplement plan. When the second person signs up, then you get a household discount on your premiums for a couple years at least. There are plans available with no copays or paperwork for covered services. I'm going to get more into that in a minute. It's important to note that Medicare supplement plans are guaranteed issue. That means that there's no medical test and they basically can't say no to you while you are in that initial coverage election period. Okay, so when you first come on to Medicare, a Medicare supplement company cannot say no to you. They are medically underwritten at any other time. Medicare Advantage plans are not medically underwritten. Everybody gets a Medicare Advantage plan unless they have kidney failure and they're on dialysis. But even then, we find them a special needs Medicare Advantage plan to help them. With Medicare supplement plans, you don't have to have a primary care physician. Most people still want to have essentially a primary care physician. I do recommend it. You don't have to have a referral to see a specialist, but these days, let me tell you, most specialists, it didn't used to be this way on Medicare, but these days, most specialists are going to want you to have a referral from a primary care type physician, even for Medicare.
Process, right? Yeah.
Yeah. But the good news is that your network of doctors is any doctor that accepts Medicare payments. Your network of physicians on a Medicare Advantage plan is going to be more like, Aetna's preferred network provider, like Brown and Tolan physicians or something like that. Okay. And so you can, on a Medicare supplement plan, it's important to note that if you want to go see like some hotshot cardiac surgeon at the Mayo Clinic in Chicago or something, because he's the best guy in the country at doing the procedure that you need, and if he accepts Medicare, which most doctors do, then you're going to be able to see him. Whereas on a Medicare Advantage plan, if that special doctor is not in your plan's network, you're going to have to fill out a bunch of paperwork, request exceptions, and even then, the plan might say, nope, can't go see him. Sorry. You got to go see our guy.
Okay.
So I need to go get a cup of coffee. I'll be right back.
Yeah, go ahead. I got to turn the heat down on the stove real quick.
All right, cool.
5. But Sandy, I still have you here, huh?
Yeah, I'm here.
You know,
I'm gonna be 65, just December 24th of this year. So
oh,
we're
okay. Well, so you guys are going to be
so I needed to be here also.
now. Is Dennis going to continue working, or is he gonna uh, kick the employment to the curb and start enjoying
No,
some retirement?
honestly, both of us would love that. Uh, but we feel like we're not quite there, with the current times. I'll say that much.
Mhm.
So we're playing it cool and just continue to work for probably another couple years.
Fair enough. Fair enough. And then you probably put off your Social Security for a couple years as well.
Absolutely.
Yeah, good, good.
I'm a pretty good breadwinner, and I want to maximize that if possible.
Perfect.
Yeah.
Supplements do not include the prescription drug coverage. So again, you will
Right.
have to get a standalone prescription drug plan to go along with it. This is a chart of all the Medicare insurance plans, but this is more accurate because they got rid of plans C and F. So right now, the most comprehensive Medicare supplement plan is the Plan G because oops, it covers everything at 100%, even if you're out of the country. Foreign travels cover, emergency is covered at 80%. Some of the Medicare Advantage plans do include a foreign travel coverage benefit. So
Well,
that's something to look
can I
at.
stop you right there?
Mhm.
What does that mean? Uh,
Uh,
I,
if if you're out of the country and you break your
oh, that.
leg,
Okay.
you got to go to a hospital and get a cast
Oh,
put
okay.
on.
Got it. Okay. Thank you.
Yeah. Um, then Plan N is the second most comprehensive plan. The only thing that it does not cover that Plan G covers are what we call Medicare Part B excess charges. Doctors are allowed to charge up to 15% more than what for a procedure or service than what Medicare will reimburse them for. Okay. If that is the case and you see a doctor that is charging more than what Medicare will reimburse their office for an x-ray, and that x-ray costs you $200, then you're going to pay $30 for that x-ray if you're on Plan N. So a lot of people do like Plan N because the premiums are slightly less than Plan G, and a good way to avoid the Medicare Part B excess charges is to simply ask the doctor's office, do you charge Medicare Part B excess charges? And they have to tell you yes or no on that.
Can I know I'm probably being a dumb question here, but
No,
um, why again is B or C and E blacked out?
because the federal government took them away.
Oh, okay, fair enough.
Yep.
Got it.
I'll tell you, because so my mom's 90 years old, is legally blind, has fairly severe dementia, is in assisted living. Thank goodness she's got a decent long-term care plan that's paying for that. Um, and my folks way back in, gosh, I can't even remember what year it was that they went on Medicare, but it was a long time ago. Back then, there was a Medicare supplement plan called Plan J, and it covered everything Plan G does, plus that Part B deductible and all of their prescription costs. So I cannot tell you how valuable that has been for my family. I mean, when my father passed
Excellent.
away, he was in hospital for 5 days and then skilled nursing for 2 weeks. And
Oh,
we never saw a bill, several ambulance rides
okay.
and things like that.
Uh,
So,
hold 1 second. I gotta
mhm.
control my dog barking at someone at the door. Hold on.
Oh, I have that too.
Okay, keep talking.
All righty.
Thank you.
So
Sorry about that. Uh, so,
again, I probably didn't quite also uh, cover the fact that so a Medicare Advantage plan, uh, there's some of them that have a $0 co-payment when you go to see your primary care physician, and then maybe a $15 to $20 co-payment anytime you go see a specialist. But the long and short of it is Medicare Advantage plans, every time you go for an appointment or receive a covered benefit, an X-ray, outpatient surgery, anything like that, you're going to have a copay. They're all the plans have different copays for different services. So it's important to look at the plans carefully. Whereas generally on a Medicare supplement plan, you don't have copays. You go in, if you have Plan G, look, all your stuff is pretty much covered.
okay,
Okay, at
well, can I just
100%.
stop you right there just for clarification? So you said that the government took away C and
Yeah.
F.
C and F, correct.
So with the supplement plan, that's what covers what would be that Medicare had, right?
It covers that 20% of costs that standard Medicare doesn't cover.
Okay, got it. Okay. So they just
Mhm.
listed out though.
Oh, it
uh,
was 2020 that they took F and C away. Um, no, this stuff doesn't
Okay.
really apply a whole lot more. Important to note, there is in California what we call the California Medicare Supplement Birthday Rule, which tells us that on your birthday, in that month that you have your birthday, you should be able to switch to a different provider. Like you could switch from Aetna to United Healthcare or from United Healthcare to Anthem with no underwriting. It is guaranteed issue. Okay. Oh,
So I
let's
have
talk about
a,
the lovely, fun prescription drug program. My favorite part. Um, with the prescription drug program, it is better than what we had before 2006 because before 2006 we had nothing. So it's slightly better than nothing. Private insurance companies become the administrator of your prescription drug benefits, and they receive a capitation rate per enrollee from the federal government. So the insurance companies love the prescription drug plan program, and they love the Medicare Advantage plans too, because they get money from the federal government for each person they enroll. And the prescription drug plans, the premiums, copays, they can vary from plan to plan, from county to county, and from year to year. So if you're in a Medicare Advantage prescription drug program and enroll in a standalone prescription drug plan, you're going to be booted from your Medicare Advantage prescription drug plan, your MAPD plan. It gets kind of weird and confusing. So just remember, if you want to make changes to your prescription drug coverage, it's probably a good idea to speak to a qualified insurance person such as myself.
Okay.
You guys know the differences between HMO, PPO. PPO is you have a little bit bigger of a network on it. You don't have to have that primary care physician. You're in a PPO, even if you do have a primary care physician, they're not necessarily the gatekeeper to see any specialists and things like that. You know, HMOs have smaller physicians networks. There's less doctors to choose from. PPOs are slightly larger networks.
Okay.
Um, Once you can begin paying those Part B premiums, a lot of times people will have those, like I said, just automatically deducted out of their Social Security. That's the best way to make sure that you just never miss a Part B premium payment. It can cause problems.
Mhm.
With Medicare Advantage plans, a very important thing to look at is the maximum out of pocket, what we in the industry call a MOOP. Same with prescription drug plans, kind of have a MOOP also. This is the maximum that you will take out of your own pocket for covered services. So if you have your worst healthcare, well, I always use my example is you get hit by a bus. You're in the hospital, have several surgeries, you're in the ICU for a week, you're in traction, have pins in your legs, you got bad, or, you know, take something else. You got cancer and you need a lot of surgeries and things like that. This is for your real bad years. The maximum amount of money that you will take out of your pocket for co-pays for all of those services and that hospital stay, skilled nursing, etc., has to be clearly delineated in the plan document for a Medicare Advantage plan. They can vary widely from $2,000, $2,500 a year up to $7,000 or $8,000 a year. So if we go Medicare Advantage route, we want to look at that maximum out of pocket because that's kind of a big deal when your health does decline and you start using a lot of services.
So now, and this is all based on the MOOP thing is on a yearly basis.
Yep, it resets every year, correct.
Okay, so now what happens if, so like for me, I've already had 3 angiograms. Okay, so what would happen? So let's go back to your example of got hit by a bus, right? Okay, so let's say this happens in November of 1 year. So I got my bills are coming in. I hit that MOOP for that first year. So when I go into the next year, then that clock restarts even though I'm on the same accident thing.
Correct. Let's take it even one step further. Let's say you get hit by a bus on December 26th and you have a couple surgeries that max out your MOOP by December 30th. Well, January 1st, if you require more surgeries or you move to skilled nursing, your MOOP resets and you're going to pay that $2,500 to $7,000 again while you're in this right there in January.
Okay, fair enough. Well, I just wanted to make sure that.
And so again, important to note that on a Medicare supplement plan, you get hit by a bus, all your stuff is covered at 100%. You
Say that
don't
one
see
more
a
time.
bill.
Say that one more time.
On Plan G, on a
On Plan
Medicare
G.
supplement,
Okay.
all your stuff is covered at 100%. Doesn't matter what happens, when it happens, you don't see a bill. You don't pay a bill. You take no money out of your pocket. The trade-off is, as you might imagine, the monthly premiums for a Medicare supplement are substantially more than the monthly premiums for a Medicare Advantage plan. Healthcare in the United States is very much a pay-to-play system still, okay? You're either going to pay before you get the services, and then when you get the services, they're covered and you don't pay, or you're going to pay after you get the services in the form of co-pays and things like that, okay?
Yeah.
The good news is that your guys would probably think the sky is falling right now, but quite frankly, the good news is that after you get on Medicare, it actually kind of stabilizes things and it's better. Okay, it is better. Medicare is a very successful and good program. All right.
As long as they don't take it away, because you know who.
I know. Okay, I'm gonna give you my 10 cents on this. You wanna know the quickest way to get even everybody in the red states out rioting in the streets and burning down the government buildings,
Yep.
take away Social Security and Medicare.
Yep.
Yeah,
They will.
I hope they would rise up and do that.
Oh, they will, because they will suffer the most from it. We saw what happened back in the early 2000s when Argentina tried to do something similar to that. We've seen what happens well, in France, they riot over everything for crying out loud. But you know, my suspicion is that, I mean, because that quite simply, that's essentially just it's taken away everybody's money that they paid into these programs. And when you start taking money out of people's pockets, I think even in the red states, they will freak.
Yes. So just a little bit about me. I've been paying in since I was 15 and a half. I started working and getting my driver license. So that's a long time to pay in. And I'm going to get like $3,000 a month, if I wait till 67. So that's a pretty good little bit of money, that
Right.
will go far, you know.
Yeah. You know, a lot of people that do what I do, especially when I'm doing the retirement planning side and things like that, a lot of people use the threat of losing Social Security. A lot of people that do what I do, they'll use the threat of losing Social Security to get people to put more money into a plan and things like that. Like, well, you can't rely on Social Security. You don't know if it's going to be there. I could kind of take the opposite approach, quite frankly, because like I said,
Well, I'm glad to hear you say that.
you take Social Security away from people in this country, you will have them out in the streets burning stuff down.
Yeah. Okay.
And not to mention, we are a very well-armed population in this country.
I think so.
I know so.
Right.
Well, thank you for that.
So, prescription drug plans. I already kind of discussed the late enrollment penalty. We're not going to have one of those, okay? Because we're going to get you on a prescription drug plan and avoid that. You don't want it.
Can I stop you for just a second?
Sure.
I just want to make sure my brain's working okay. So the slide that you showed with Medicare A through G and N, that all of those fall under what you call
Medicare Supplement.
Advantage.
No,
Yeah.
these are Medicare Supplement. Okay, so
Okay.
the
That's
A,
where I got
B,
confused.
G, K, L, M, N are all Medicare supplements. The parts of Medicare are Medicare parts A, B, C, D. Okay.
Okay.
And then Medicare Part C is also what we call Medicare Advantage.
Which they took away.
It's so straightforward, isn't it?
Not, now I'm a little confused.
I mean, think about how somebody who's 72 years old and has maybe mild dementia, mild memory problems, how are they supposed to keep track of all of this nonsense, right?
Yeah.
Um,
So Advantage is a plan, right?
Medicare Advantage are private company Medicare insurance plans where the private company becomes the administrator of your Medicare, and you're going to have co-pays or God, what's the other name for it? Co-pays for all covered services, okay? Medicare Supplement. So remember that with Medicare Advantage, also known as Medicare Part C, the private company, Aetna, steps in and is the administrator of your Medicare benefits, or United Healthcare, or Anthem, whatever company it is that you do with your Medicare Part C plan. With a Medicare supplement, the federal government, you're still on original Medicare, but the supplement just plugs up and pays for the 20% that the government doesn't pay for. Okay.
And okay, and then that would be G or N, right?
Right, G or N. So, you know, some people want to do some of the lesser plans, like Medicare Part D is pretty comprehensive. What is the difference between?
Okay.
It's very similar to Plan N. quite honestly, I'd have to look into what the real difference between or Supplement Plan D and Plan N is. I know I've
And you
got,
gave us costs on Advantage, uh, not G or N, right?
we're going to look at costs in a minute, and I'm going to kind
Okay,
of show you guys how to do it.
sorry.
Okay.
Go ahead, Dan. You had a
So my
question.
question, no, go back to that other screen.
This
Okay,
one?
so I have D, G, and N.
Mhm.
They all pay 100%. Well, okay, so G pays the most because it also pays Part B excess charges.
Right.
So right now, so to me, G is the only one that kind of makes sense, depending on what the cost differential is.
Quite frankly, I won't put people on anything but Plan G or N.
Okay, so what's the difference between G and N? Because it says they're all 100%.
Just the N doesn't cover those Medicare Part B excess charges. I think you were getting a cup of coffee. So doctors are allowed to charge up to 15% more for a procedure
What I
than
remember,
what Medicare reimburses them for.
Okay.
So
I
if you go
remember,
for
I
an
remember you talking
X-ray,
about that.
what's
Okay,
that?
so the
Yeah,
big,
so if you go for an X-ray and it's $200,
Yeah.
and that doctor charges 15% more, that doctor is going to charge you $30 out of your pocket for the X-ray. Plan G would cover that, Plan N doesn't. As I told Sandy, an easy way to avoid Medicare Part B excess charges is just ask the doctor's office, do you charge Medicare excess charges? And they have to tell you. And if they charge excess charges, then find another doctor that doesn't.
okay,
Oh, prescription drug plans. Let's get back to this. So, of course, all prescription drug plans have tiers of drugs. Tier one being the lowest cost drugs, generics. Tier two being their preferred brand name drugs, that's the drugs that come from companies that they've negotiated better prices with on. Tier three, non-preferred brand name drugs, going to be more expensive than the preferred brand drugs. And then tier four are the specialty and unique drugs. They're generally not cheap and are often things like injectables and stuff like that. Oh, here's my only joke when it comes to Medicare prescription drug plans. Uh, I do not call it the donut hole because donut holes are these wonderful, sugary, fried pieces of dough that are covered in sugar, and we love them. Uh, there's nothing to love about the Medicare prescription drug plan donut hole. I call it the coverage gap. That's what it is. Wasn't that funny?
Yeah,
So,
I got you.
your prescription drug plan, you're going to have your annual deductible. That's $590. Um, after you pay the first $590 of your prescription costs every year in 2025 at least, then you go through to your initial coverage phase. And after you meet the deductible, you pay 25% of your prescription costs. So if your prescription costs $100 for a 30-day supply, you'll pay $25 for that 30-day supply. That is until your out-of-pocket costs reach $2,000. It's actually the whole $100 of that prescription applies to your out-of-pocket costs. So even though you only took 25%, $25 out of your pocket for that drug, the whole $100 applies to the $2,000 out-of-pocket cost that then, once you hit that 2,000 mark, once you enter catastrophic coverage, then the prescription drug plan is going to cover 100% of your covered costs. Okay.
okay, so I have a question then. So I have a drug that I take
Mhm.
that if I have no prescription, I know, I'm just, is, so without my insurance coverage, this is $500 a month for 30-day supply. Okay, I pay right now, I think I don't know, 20 something dollar deductible.
Right.
So going into this thing, so I've made my $590 initial coverage, right? I know
Yep.
the deductible. Now I'm into initial coverage. So
Right.
for this $500 a month thing, so if I have to pay 25% of that, that means I pay $125 a month for this particular drug,
Right.
right?
Possibly. Here's the kicker about the prescription drug plans. Remember, I said that they cover different things in different ways in different zip codes and different counties. I'm also going to show you how to find the plan because the prescription drug plan, especially if you are taking a few expensive medications, you have to look at what plan is going to cover your medications the best every single darn year. It's super annoying.
Okay, okay, thank you.
Yeah, like I say right here, bottom line, it's very confusing and complicated and downright annoying. You have to run your list of drugs every darn year there in about October, November to see which prescription drug plan is going to cover your drugs the best. Um, it I don't like it. It shouldn't be that way.
I, but I have,
That's
well,
kind of why I don't want to be on anything. And knock on wood, I'm not yet, but I probably will be, at some point.
You know, we all are at some point, usually. Um,
He is, but I'm
like I
not.
said, knock on
well,
wood. Let's hope
and
not, but
going back to like what you said earlier, though, what about these people who get up in age and can't think quite so clearly? How are they going to know?
I hope they've got a family member or a decent Medicare specialist to help them out with things.
Okay,
So on this point right here, to research the prescriptions, so they will provide, as part of their pitch or whatever they marketing, we
I'm
can.
going to show you guys how to do it yourself because that's pretty much about it for my presentation as it applies to you guys. You should know with Medicare Advantage plans, they have star ratings that tell you kind of how the people that are on them and what the doctors that service them think of them. The prescription drug plans have the same type of thing. Oh, I did want to tell you how do you get rid of telemarketers? You get them. I don't think there's a lot of telemarketing going on anymore. There used to be, but anytime you get, well, actually, that's not true. I still get phone calls because I do Medicare work. All the companies think I'm a Medicare beneficiary, so I get calls all the time saying like, "We're here to help you with your Medicare." So again, the telemarketer scripts are things like, "We'd like to make sure you're getting the most out of your Medicare." That's a telemarketer. That's somebody like me that's trying to get business. We like to schedule you for your free yearly Medicare benefits review. That's probably the most common one. Okay. That's simply somebody that's setting appointments for an agent like me, and I'm going to come in and tell you, oh no, you need to change plans because that's how I get money. We'd like to send a representative by with important information regarding important changes to your Medicare benefits. Is there a time you'll be home tomorrow? So all of these are telemarketer scripts. So
Yeah,
what you say is you say, oh, first and foremost, what is the name of your company again? Because I'll say it really fast at the beginning, okay?
yeah. Oh,
Right?
I'm on it with telemarketers. I'm not very nice.
Write down the name of the company and tell them, please put me on your do not call list. If your company calls again, I will report it to CMS, Center for Medicare Services. Um, and then you can also ask if they're a captive agent or a broker or independent agent. Captive agent, you're not going to get into that. I don't even know why I have it in here, frankly.
oh, but because it's good to know because that's the first thing I did as I saw this captive agent. I'm like, what the heck is that? But I mean, you talk about it further on, but that's
Right. It's
grabbed my
captive
eye.
agent. It can only work for one company.
Right,
Okay.
right. I
And they
understand that.
probably get a salary from that company.
Right,
a broker and an independent agent. Nobody pays me any salary, but I get a commission when I sign people up.
right,
And again, so remember that I work for my client, not for a company. Uh,
right.
part of, and I think I talk about it here, you know, so I therefore act as an advocate on behalf of my clients. If you have a problem with your Medicare plan, with the way it covered something, you call me and I call the insurance company and I yell at them about it, not you.
Oh, that works. Yeah, we like
I
that.
like that.
And that's pretty much it. So I'm gonna close this one down here.
You said
I'm
you
gonna
had costs though for the G and N.
let's take a look at that. I'm gonna show you the Center for Medicare's website here. It's an important one. It's Medicare.gov. Have you guys been there yet?
Not yet.
No,
Okay.
I do have a Social Security profile, but no, I haven't been to Medicare yet.
Yeah,
Okay.
we're in denial of our ages, I think.
Well, aren't we all? You know, what do they say? The 65 is the new 55, et cetera, et
Yeah.
cetera.
Yeah. We try to be young.
So, can you see the screen that popped
Yep.
up now?
Yeah.
www.medicare.gov.
Right?
Let's show you guys how to find stuff. Find plans now. Remember that, your zip code is 95112.
Really
And so
huge.
first thing we're going to look at is the Medigap policies. Remember,
Huge.
Medigap and Medicare Supplement are the same thing. Okay. It's funny that they still call them Medigap policies on the website because that's a little bit of a dated term, but I guess it's not. You are 65. You are male. You used any tobacco in the past 12 months.
No.
You're not going to get a household discount yet. When Sandy signs up towards the end of the year, if you're both signing up at the same time, then you get a household discount.
Oh, good.
And update prices. And it's real simple right here. They're going to show you what the going premiums are for each Medigap plan C, B, and G. Let's look at Plan G real quick. Plan F is no longer available. Plan G, let's look at view policies. This is going to give us all of our big companies that offer them. And they're going to start with the lowest monthly premium first. So $144 a month for Plan G from Blue Shield. I don't have a problem with that. Here's where we have problems. Washington National Insurance Company. Ever heard of them?
No.
Ace Property and Casualty Company. Ever heard of them?
No.
Don't ever do your Medicare with anybody that's doing casualty insurance right now. These are the companies that are having problems because they can't cover their claims from the fires, hurricanes, tornadoes, and earthquakes.
Oh, got it.
Okay? Blue Shield, all they do is health insurance. I'm liking that one so far. AARP, pretty much industry standard. Here's a big difference. Blue Shield uses what they call attained age pricing. That means it's going to go up a little bit each year. The older you get, the more they're going to charge. UHC, AARP use community pricing. This means that you pay the same amount as everybody else in your community at your age with the same type of health problems. Does that make sense?
Yeah.
So the premium might be a little bit more stable. United Healthcare is also the biggest player in California, probably the nation, when it comes to Medicare supplements and even Medicare Advantage plans. So that means that they have the biggest pool of covered people that they are collecting premiums from. And so this helps. The more people you have in your pool, it spreads the costs out over more people and keeps your premiums stable. Okay. State Farm, don't do it. They do autos and cars, don't do it. Plan G Extra. What is extra about their Plan G, I wonder? Plan G Inspire. I'm going to have to take a look at what Blue Shield's Extra and Plan G Inspire are. Quite frankly, I'm not familiar with them, and I wonder if it tells us anything about it. Well, I could probably do a quick Google search.
Mhm. So this is all available once you log into the Medicare account.
You got to get, oh yeah. So this is the CMS website that's available to anyone, anytime. Plan G Extra.
CMS. CMS website?
No, this is just Medicare.
You can enjoy up to $3,000 in extra benefits. Huh. Let's see if it tells us what the extra benefits are.
No, that has nothing. That's it.
It doesn't.
Um,
Okay. Oh, I forgot a very important thing. There's another important difference between Medicare Advantage and Medicare Supplement or Medigap. Quite often, the Medicare Advantage plans contain in them some dental and vision benefits, which can be helpful, and extra benefits as well. So, as I said, the Medicare supplements, they're all pretty much standardized. They're the same from company to company. You're looking for low premium and or a pretty darn low premium and community pricing, which is more stable. I'll put it to you this way. I put my parents on the United Healthcare Plan J 20 some years ago, I think it was. And I'll never take them off of it. When it comes to Medicare, United Healthcare is kind of my go-to company. Blue Shield or Anthem is my number two. Okay. I use big companies that are reputable and stable. We have no idea what's going to happen with these companies in a couple of years. They could be gone. Let's go back to get started with Medicare. Let's look at the Medicare Advantage plans.
G doesn't cover the drug thing part, right?
Correct. So with a supplement, you're going to get a separate prescription drug plan. Oh, let's look at the prescription drug plans first. Find health and drug plans.
I think
And
it
we got a
would,
zip
but
code.
doesn't.
And we want to see just Medicare drug plans part D now. You are most likely not going to get any help from those. Yes, we want to see drug costs. Dennis, what is the name of the drug that you're taking that's expensive?
So
it's spelled.
so it's spelled there's a couple of different names here. Try ICOSAPENT. Yeah, so that right there.
Got it. And what's the dosage?
1 gram caplets.
Yeah.
And quantity is 120 every month. Yep.
Okay. Good. You got anything else you're taking?
Oh, I got
Lots of stuff.
Okay, so my next one is lisinopril. LISIN.
We know lisinopril well.
Yep.
Everybody's on that. What's the
Okay.
dosage?
My next one is clopidogrel.
Oh, what's the dosage for the lisinopril?
Dosage, lisinopril. So, okay, so technically it's 10 milligrams. So actually it's going to be the 5 milligram tablet. Because
Mhm.
I do a 10 milligram tablet, but I cut it in half.
Okay. So then you'd be doing 30 of those every 2 months.
Right.
What else do we have?
So clopidogrel, Clopeid.
That's it.
There it is.
Yep, that's my Plavix.
And 75 milligram tablet,
Yes,
one a day.
yes,
Do we have other stuff?
yes.
What?
Metoprolol, Metopr.
Oh yeah, metoprolol.
Medical.
Is it the tartrate
That one. That one.
No, because it's actually, it says
or
it's metoprolol succinate.
succinate? Yep, got it.
Yep,
That
that's
one.
it.
And how many of those?
I take so it's 25 milligrams.
Okay,
And I do it's a quantity of 30 per month.
30 per month. I'm gonna do it 90. Oh no, 90 every 3 months.
Right.
There you go.
And then
What else can we put on here?
I have my rosuvastatin.
I don't know that.
ROS.
ROS?
Yes, ROSUVA.
I thought that was good.
Rosuvastatin calcium.
That's it.
Yep, I guess.
And what is our dosage on that?
40.
40 milligram,
Yep. 30 a month.
30 a month.
Yep.
What else can we put on here?
That's cholesterol. Which is the statin. Rosuvastatin.
That's that it.
This is Crestor. Yeah, those are the only 5. Now I do take some supplements, like I take an aspirin, a low dose aspirin, and I do magnesium and potassium, but those are over the counter stuff.
Yeah. Don't want to put those in. Okay, so done adding drugs.
Walgreens.
We always want to take a look at mail order pharmacy because generally that can save you some money. Okay. What other pharmacy in your neighborhood do you like to go to?
Walgreens on Santa Clara.
Yeah, that's it. 780. That's it right there. Yep.
Okay. Now let's see what we come up with. This Medicare.gov website is very, very handy because, you know,
All right, thank you for that.
it helps me out because I'm getting the information straight from the government. I'm not doing any guessing here. I'm using their website. So if anybody ever comes back and complains to me, I can tell the Medicare agency, well, hey, I use your guys' website. I went everything through your guys' website. So that's why I did it the way I did it. So standalone prescription drug plans, monthly premium, only $1.80 a month. That's pretty good. Your total drug and premium cost for all those drugs for the year of 2025, that's this year. We don't have prices for 2026 yet. Those will come out closer to October. But total is only $840.47 for the year for all your drugs. You're going to like that, I think. Let's just take a look at if it says how they cover any of these drugs.
Oh, wait. I'm sorry. Can you go back? Up.
Yep.
Did 180 a month. So what's the 840?
No, $1.80 a month. That's your premium.
Well, what's 840 represent?
That's what CMS is telling us that your total annual cost for the rest of 2025. So from essentially May through the end of the year, it would be $840.47. So what is that? May through December is 7 months, is it?
Uh-huh.
So 840.47 divided by 7. You know, if you're lucky and they're telling us the correct information on this site, your drugs are going to be only going to cost you about 120 bucks a month. What was the super expensive one that you're paying quite a bit for?
It's the second one, the
That
ICOS.
icosapent.
Yeah,
That's my
I mean, they're going to put you on a generic for that, and it's not going to cost you nearly as much as it's costing right now.
wow.
oh so but this is a generic.
It is a generic that you're currently taking.
Yeah, so
Well,
this
then
like
even
so it's generic for this stuff called Vasipa.
okay.
Yeah,
Then that's, I mean, quite frankly, that's even better because you're already taking the generic. You know, some people don't like the generics of something because they say it doesn't work as well as the brand name. But for a drug like that, boy, I tell you, it's gonna. I mean, so oh, here's how it tells you so. Walgreens is a preferred network, a preferred pharmacy, but you will save money by doing at least that icosapent
mhm.
through the mail order pharmacy.
Do it.
Interestingly, most of your other stuff is a
Or
little bit cheaper at Walgreens.
Yeah,
Oh, not this one. The metoprolol isn't.
yeah,
Metoprolol
yeah.
and icosapent going to be cheaper through the mail order pharmacy. For everything else, you can continue using Walgreens. But yeah, shoot, you use the mail order pharmacy, you're going to be saving even more money. So that's good news. And we'll get a little bit deeper into this. And
But if they're just
here we have.
estimating, Mike, if they're just estimating that that's what it costs, are they saying $1.80 a month is regardless of what you pick?
Well, that's your premium. That's just your monthly premium to get access to the prescription drug plan.
Right.
Okay. And then the 840.47 is probably what you're going to pull out of your pocket for the cost of your drugs, or 439.65 if it's a mail order pharmacy.
so, but in this case, with the way it looks at it, I'm never going to fill my deductible of $590 a year.
You will. Your deductible is actually wrapped up into this.
Well, but
Okay.
if I do the mail order stuff and it's only $439.65, that's below my deductible.
Right. But that very first month, you're probably going to have to pay full price for a couple of those drugs. That 590 is going to come out of your pocket before the plan starts covering stuff. Okay.
Okay, that's what I needed to know. Okay.
Let's just, for the heck of it, let's go back and look at Medicare Advantage, kind of the one-stop shopping plans. Medicare.
So the $1.80 doesn't cover,
That gives you access.
or just,
That's just your premium that you pay to the company.
Like, to give you access to pay them more money.
I'm confused. So if we just pay out of pocket.
Remember, your premium is what you pay to the company for the pleasure of getting on their plan.
But it doesn't cover anything.
But it
But
does.
it covers just the cost of you being on their plan. There's some in some zip codes, like out in Sacramento, there's a whole bunch of prescription drug plans that have no premium at all. Sacramento County, LA County, there's a bunch of prescription drug plans that don't even have any premium, but you're still going to pay the copays for the drugs and things.
So that 439 saying it still comes out of our pocket. So what do they, why is my brain not getting this?
That's going to be so. Remember when we were looking at those drug prices at Walgreens, I think it was, the metoprolol was like 29 bucks for a 30-day
Yeah.
a 30-day supply. And the mail order pharmacy was, I think, like 19 bucks for a 30-day supply. Those are your co-pays for the drugs. That's what adds up is that's what they're adding up there to come up with that 847 or that
Oh, it's
$439 number.
co-pays,
Okay.
Right.
not the actual. um,
Yeah.
Oh, thank you. That I, I was not, it wasn't computing
It's
otherwise.
confusing. I hate these things. Okay. I hate the prescription drug plan, but they're necessary. Okay. So Medicare Advantage plans. As I mentioned, a lot of them have additional benefits like some vision coverage, dental coverage. Uh, Transportation means that if you want to get transported from your house to and from a doctor's appointment, they'll pay for transportation up to for like 5 or 10 visits a year. Um, Astiva, ever heard of them?
No.
Nope. They got a lot of, okay, I'm gonna go, I've heard of Imperial. Um, I've never put anybody on an Imperial plan. It's a regional plan. It's only here in California. There's lots of these now. Um, Scan is not a horrible company. I've put people on Scan plans before. I don't have a choice with them. They've been around for a good long while now. Anthem, again, one of my go-tos, just because I know they're big and stable. And so what that means is that they tend to not mess around with the coverage on their Medicare Advantage plans from year to year. Generally, their plans are pretty stable. What can happen, it's super annoying with the Medicare Advantage plans, is that you can get on a great Medicare Advantage plan that has a very, very low MOOP, $800 in network. That's nothing compared to some of these other plans. And remember, that's the total that you pay out of your pocket for covered services if you get hit by a bus. Um, your drug costs pretty low on this plan. I like it as far as the Medicare Advantage plan goes. It's got a lot of additional benefits. Um, what's the difference? There's not, why would you go with an Anthem plan that's going to cost you $200 more a year for your drugs and possibly $2,100 more if you get hit by a bus? I don't understand why anybody would do that. Alignment, never heard of them. Never heard of them. Never heard of them. Imperial, I don't really. Blue Shield, again, we're getting up into plans where the maximum out of pockets is so high. Why would I put anybody on that plan unless I'm getting some type of kickback from the company on it when I have, uh, when I already know I've got, Lord, this other plan that, as long as it's around, it's by far the best deal, right?
Yeah.
But what happens is that sometimes you get on a great plan like this, and the company offers it for a couple years, and they realize that they're actually losing money on it. And
Right.
when that happens, they pull that plan. And so you have to go look for a new Medicare Advantage plan. Medicare supplement plans, well, the federal government can pull a plan like they did on Plan F back in 2020. Doesn't happen too often. And as long as you're already on Plan G, when the government decides to pull it, they can't kick you off it. They have to let you keep it. My mom still has her Plan J. They got rid of that one like 10 years ago. Okay.
Mhm.
So That's probably way more information than you were hoping for, and that your
Great.
Saturday morning minds can even retain.
Well, you know what? It
So,
was fabulous. Thanks so much for humoring our questions and
But okay, so the one question that I haven't had answered.
mhm.
So I have to go to Medicare.gov and create an account. And
No,
then from there that walks me through signing up for it.
no. The first thing you got to do is call Social Security and talk to them about the timing on your Part A and Part B. Okay. Um,
you
I'm
said,
gonna I'm gonna contain kind of the step-by-step process for you when I follow up with the email. So number one,
huh?
calling Social Security, getting Part A and Part B. After you have Part B in place and they've issued you your Medicare number, then that's when you're going to say, "Hey, Mike, now I need to get now I need to get a Medicare plan." I'll be quite frank with you. I'm throwing myself under the bus here. You can come to your Medicare.gov website at any time. Anybody can come here. I don't have an account with them. I just come here as a normal person, and you can do all this fun stuff yourself. And you see on every plan we've looked at today, including the prescription drug plans, including the supplement plans, there's always an enroll now button. Okay.
Yeah.
You can enroll on your own and go through the Medicare website and not use somebody like me. That is your prerogative. Um, it does not cost you any more to have me enroll you in your plan. And then I do get paid a commission from it. And like I said, I act as an advocate on your behalf. Here's an important uh, note and difference between Medicare supplement. This might make it a little bit more clear to you. My Medicare supplement customers, I never get a phone call with a problem from them saying, "Hey, the plan didn't cover this procedure and I got to pay $150 out of it." I don't ever get that call
Uh-huh.
because the Medicare supplement plans, we know how they work, we know what they're going to do. They're always the same no matter where you go and what state you're in.
Okay.
Medicare Advantage plans, I get calls from people. Hey, it's not, I'm paying all of this money out of pocket. I'm having health problems and it's not, this is not what I wanted. And that's when I have to remind them that I told them very clearly that
But it
that
doesn't.
could happen.
Yeah.
And unfortunately, now that you do have severe health problems, I can't put you on a Medicare supplement plan because they're medically underwritten.
Right.
Okay.
Okay. Okay.
So, again, the Medicare supplement plan, it's going to cost you more money out of your pocket for your premiums, number one. You're going to have to get a standalone Medicare prescription drug plan, Part D, as well. And then if you want dental and vision coverage, we sign you up for a third-party private dental and vision plan. So you're looking at more monthly costs to get complete coverage, but the coverage is better and standardized. And you always know that as soon as you have everything in place, that your monthly out-of-pocket costs are going to be the premiums for your Medicare supplement, the premiums for your dental and vision plan, and the premium and copays for your drug plan. But that's going to be a set cost per month. So even when you get hit by a bus, it's still going to be somewhere in the neighborhood of maybe $300 to $400 out of your pocket per month. And then you never see a bill for all of that stuff that they did in there. 3 different surgeries, 4 days in the ICU, 7 days in skilled nursing, physical therapy. All of that stuff has copays associated with it on a Medicare Advantage plan, no copays on a Medicare supplement plan.
Okay. So, okay, that makes sense. Okay, so that's probably how we're gonna lean to go.
I always tell people, boy, let me tell you, if you can afford it, Medicare supplement is the way to go. I'm
I
helping my
agree with you.
cousin. and
You
his
already
wife right
sold me.
now with Medicare, they can't afford a supplement.
You sold me on that.
We gotta
Yeah.
find out the cost.
Yeah.
So, but as you can see, even for folks that can't afford a supplement, a Medicare Advantage plan is going to be a heck of a lot better for them than
And not.
than not having a Medicare Advantage plan. Okay.
Oh, I get
So,
that part. But you don't want to end up frustrated that you picked the wrong one.
right, right.
This, you
Um,
just laid out the drug thing for us, and that was so helpful. Thank you so much.
Yep. Yeah, my pleasure. Like I said, I do. The funny thing is, I don't do a ton of Medicare anymore. They've really made it this whole recording thing makes it kind of very difficult. I have to have a lot of server space and storage in order to save all this stuff. And so I'm a little bit more focused on the retirement planning these days, but as Medicare can be a very important part of retirement planning, I still do that for folks. And how did you guys find out about me?
Through
Jim
Jim, through
Anderson.
Jim Anderson.
Oh, okay, great, great. Yeah, I know Jim well. Yeah.
Yeah, so he was really inspiring to uh this notion of not going with the Advantage plan. And I have a friend that is on the Advantage plan for her and her father who has dementia. Um, and it works well for them, but
Mhm.
I tend to want to believe Jim in saying, go with a plan and have it laid out, a supplemental
Yeah,
plan.
Jim and I, we talked at great length about it. And you know, I, again, what I do is I try to give people the complete stack of information. As you just
Appreciate
saw,
it.
there's a lot of it, so that they can make a good, educated decision. But at the bottom line, you know, the following, I'm able to usually, after about a half an hour of talking to people, I can tell whether or not they're going to go on a supplement, whether they can afford a supplement, or whether I'm going to be talking about Medicare Advantage for them.
Yeah.
If I know they're going to Medicare Advantage, I don't tell them, well, if you can possibly afford it, get on a supplement because it's going to be the better way to go. I don't say that to them because that's not really a good thing to tell people. That like, sorry, you can't afford the better coverage. You got to go for the crummier.
Yeah. No, I
Um,
understand what you mean. It's a delicate walk.
right.
Um,
At the end of the day, though, make no mistake about it. Like I said, a decent Medicare Advantage plan with a good company, it will do wonders for folks that are in lower income brackets. I mean, there's no two ways about it. I mean, what was it was it the Anthem that I think it was an Anthem plan that I was looking at here uh on that other page. I mean, in your guys' zip code, where did it go? In your guys' zip code, I mean, think about for somebody who's on kind of a fixed income and is taking some expensive drugs, if we can get them to the point of no monthly premium, $400 for the rest of the year for their drugs, and an 800 maximum out of pocket, that's a big deal for those folks.
yeah.
And I mean, quite honestly, I wouldn't have if you guys came to me and said, "Hey, I don't want to pay the couple $300 a month for the supplement. I want this thing." I wouldn't have a problem with that at all. It looks like a perfectly fine plan to me. Um, so
Vision, dental, and drug.
right, there's a lot of benefits to this. You get a lot of benefits out of a plan like this. So, I shoot. It's pretty darn good as far as a Medicare Advantage plan goes. Remember, you're going to have an HMO, point of service type plan. You're going to have a small network of doctors to choose from.
Mhm.
Then, it parts in a case like Dennis's, I would go straight to the Anthem website and we would look at their providers and make sure and see if his doctors even take it, right? The doctor, your cardiac specialist right now might not even accept this plan. And if that's the case, then you're probably not going to be as happy about it, right?
Exactly, because we have very good doctors for
Yeah.
Anthem right now.
Medicare supplements, it's very, very rare that we meet any doctors that won't accept them.
That's good to know. Kind of why we're staying here too, even though we'd like to move to the Central Coast. Where are you located?
Santa Rosa.
Oh,
I grew up in Menlo Park.
oh, yeah, you're one of us.
Yeah. I remember when it was all fruit tree orchards in between
Oh,
Mountain View
yeah,
and the
I
San
hear
Jose
that
Airport.
often. I hear that often. Yeah,
Yeah.
uh, I- it's home. We've had the old Victorian house. Well, I've had it 35 years across from a park on 13th and Jackson in San Jose. And it's a busy street, but it's kind of cool. And it's centrally located. Have to commute 6 miles, which equates to an hour sometimes on 101. The traffic's that bad.
Nothing wrong
Um,
with that. Yeah.
if we didn't work, it would, wouldn't be so bad. But because we work and our tolerance level is waning as we get older for traffic.
Well, it was funny. It was about 30 years ago or no, so now, when well, my dad just passed away about in 2022.
Oh,
But at
sorry.
one point, I asked him, I was living in San Francisco. My parents had moved up to San Francisco, but I was playing in a band that rehearsed in East Palo Alto, like so far deep into East Palo Alto that when it rained real hard, like the bay started looking at the doorsteps of this place.
Uh-huh.
Um, and I asked my dad, I was like, Dad, back when I was a kid, we used to go up to San Francisco on the weekends, or we drive up to see you when you're working, because he worked in San Francisco. We lived in Menlo Park. And like, I don't remember sitting in traffic for an hour the whole way
Uh-huh.
from Belmont to San Francisco. He's like, that's because back then you didn't sit in traffic. There was no traffic.
Uh-huh. Oh my
Um,
goodness.
And
It's
here in Santa Rosa, we have bad traffic every day now. It's I mean it always has been. Petaluma's the
That's,
worst. Good Lord,
but that's what happens when you have 40 million people in the state.
too many dang people. Too many dang people.
Well, San Jose's hovering about, right now, they're just under 1 million people in San Jose.
Yeah,
I mean,
yeah.
that's good. But I mean, everything has grown. I mean, look at what's happened out in the places like Livermore, and what are those other places out there?
well, even if you go south and you go to like Los Banos and all of that stuff, all those bedroom communities, they've just exploded in the last 30 years.
They
Yeah.
have, they have. I was just mentioned in Livermore. I was reminded. I was just watching a comedian the other night. Said something funny. He's like, "You Californians are so funny. You like every time you ask, oh, you're Californian. Well, you never say, oh, I'm just from California. You always say, oh, I'm from Northern California, or I'm from Southern California. It's never just California." And then he's like, "Oh, what part of Northern California?" And you're like, "Oh, the Bay Area." And we're like, "Oh yeah, well that helps. That really narrows it down. What part of the Bay Area? Well, like, where are you actually from?" And then we really drill down and you finally answer, "Well, Livermore."
But
Are you recording us still?
Yeah, yeah, I should probably stop that.
We're chit-chatting. You don't want the feds to know what we're talking about.
Okay. Well, and hey, I got to get going. I got to get some
Okay.
food in me.
It's very nice to meet
Um,
you.
I'm gonna send an email to you guys just with a couple. I'm gonna give you the phone number for Social Security to call and things like that. A little bit of a step-by-step process, and I'll see if I can get the PowerPoint to go through to you.
Okay.
Um,
Wonderful.
Sandy, do you want to be CC'd on that at all?
Sure. SRUSK at pacbell.net. PACBELL.net.
Got it. Give me a couple hours and I'll get that to you, okay?
okay,
All
That's
right.
great.
Well, it's great meeting you. Thank you so much. This was awesome. Thank you.
Pleasure talking with you guys. And the only thing that I ask is that if you did get a lot out of it, by all means, like Jim did, share it with your friends so they can make the same type of educated decision that you
Yep.
can.
We sure will.
Absolutely. No,
Okay.
Oh, and after you get your Medicare number, hit me up. And when it's time for you guys to enroll, I certainly would like it if you let me enroll you, and I can make a couple bucks.
Oh, you bet.
Yep.
Absolutely. Got it. Thank you so much. We will.
Have a lovely rest of the afternoon. I'll be in touch.
You
All right,
too.
you two
Take care.
take care. Thank you.
Bye-bye.
Bye.